As positive cases of the coronavirus continue to rise in the country, more children have joined those totals, and that same trend is happening here in Kentucky.
But most kids still tend to be asymptomatic. So how can we make sure they and their families are staying as safe as possible from the virus?
Alex Valverde spoke with a pediatric doctor at UK Healthcare to get the answer in this coronavirus coverage.
Since the pandemic began, more than 1 million children have tested positive for COVID-19, according to the American Academy of Pediatrics. And the U.S. is coming off of a weekly record. There were nearly 112,000 new cases in children in the 1 week period ending November 12th. And while these numbers are new, one thing appears to be the same as early on in the pandemic.
Those children aren't even symptomatic.
Dr. Carol Steltenkamp with UK Healthcare says a majority of young patients who test positive for COVID-19 don't come in because they show symptoms. They're tested before being seen for an unrelated procedure. Over the summer, many elective procedures were paused. And now that they're being done again, we're discovering more positive COVID cases in children.
We're just reinforcing what we know, and that is that even children, when they get the COVID virus, really tolerate it much better than adults, and particularly elderly adults, or those who have some sort of pre-existing or coexisting condition.
Even though children tend to be asymptomatic, Dr. Steltenkamp says right now the American Academy of Pediatrics does not recommend randomly testing your child for the virus unless there are special circumstances discussed with your doctor first.
Say if you're going to be traveling, should you test if there's some instance where you're going to be seeing grandma or grandpa or some older person.
To help keep families as healthy as possible, Dr. Steltenkamp says to keep wearing masks in public, and that includes children older than 2. And she encourages parents to keep an open discussion about the virus with their child so they know how to tell if they're sick or if someone they've been around is sick. In Lexington, Alex Valverde, LEX 18 News.